Kia ora koutou and welcome to this second presentation for the Year 3 Physiotherapy Clinical Assistantship. I am Sarah Bonham-Lloyd presenting these slides, and the following slides are all about assessment of the clinical assistantship. The assessment of the clinical assistantship is on one learning outcome. And that learning outcome is to demonstrate selected skills, behaviours and attributes in the context of clinical practice. Within this learning outcome, there are 6, we might call them elements or 6 criteria, but the word I'm mostly going to apply to this is 6 indicators. They are selected skill, behaviour and attribute indicators to enable the students to meet the learning outcome. Each indicator is assessed as a pass-fail component, and students must pass all 6 indicators to pass the learning outcome. So that really means to pass the placement. To support you in completing the assessment for the clinical assistantship, we have provided this table, which I will also refer to as the marking guide. And this provides examples of how students may demonstrate the required indicators or potentially how they might not. So on the following slide, there are also a few supplemental notes to support this table and create the overall guide. So the guide are attached to the marking sheet, so you can use this guide during your marking process. The marking sheet this year will be completed on a PDF document, and at the end of the 2-week assistantship you need to complete the marking sheet, discuss your marking and any feedback with each student, and then email that completed form to your clinical centre leader, and we also ask you to email the completed form to the student. Students are required to upload the completed form back onto our Canvas system, so they do need that copy of the completed form from you. For any past students or supervisors who are listening who have used ePortfolio before, AUT are no longer using this platform for physiotherapy students, hence using a PDF document. A key point just about the bullet points shown within this table in the pass and fail columns is that they are solely provided to you as examples of how students may demonstrate the required indicators. So the bullet points are not a checklist, but they also don't provide a possible example of how every indicator may be demonstrated or may not be demonstrated. So during the clinical assistantship, if some situations arise that are not covered by the examples in this table, please review the supplemental notes at the end of the guide or discuss the situation with your clinical centre leader to help you establish what indicator that situation may best represent. And if your clinical centre leader is also unsure, they will contact AUT for further discussion if needed. So just a reminder too about completing the assessment within the clinical assistantship is that it's considered a continuous assessment. So that means students are not assessed on any indicator at one point in time. They are assessed across the continuum of the 2 weeks, but they need to meet the required standard by the end of the 2 weeks. So this gives allowance for students to make mistakes or errors, be provided with feedback on those mistakes, and have opportunities to correct themselves. So if there were any indicators that you think are not being met by the students at the end of week 1, they might sit in that fail category, then students need to be provided with feedback from you, and I'll explain perhaps how that feedback might work in a few more slides. But also it could be that the students, you may not have had an opportunity for the students to demonstrate they're meeting a particular indicator towards the end of week 1. So that's also that opportunity for you to consider actually what future opportunities there might be in week 2 for students to be able to demonstrate all of the indicators. So as you'll see within the fail column, what's really important here is we say that it's despite feedback, that there's still perhaps infrequent or limited demonstration of any of the items or any of the indicators. So it's really important, as I said before, that you do provide students with some feedback if they are not meeting the required standard, and that you let them know what it is that they're doing or possibly not doing, and discuss some ways or strategies that you could support the student to hopefully turn it into a demonstration that they are passing that criteria. However, also, if you have given students feedback and despite that feedback, the student is still not meeting the required skills, behaviours or attributes expected of the indicators, then it is important that the student does fail. But a further reminder is that if you do have any concerns about a student's performance, or there is a possibility that they're not on track to pass, or you've given them this feedback that they're not on track to pass, you must have notified your clinical centre leader about this already. We don't expect you to manage those conversations necessarily on your own, but it is really important that the clinical centre leader knows about these issues. They can notify AUT, so we know about the issues, but also really important that the student knows about the issues too, so that there's never any surprises when it becomes to the end of a placement. The supplemental notes to the table provide some further explanation and examples for the words that are bolded within the table. So we have also referenced a few key standards from the Physiotherapy Board of New Zealand that can be used as a reference for you to guide how students may demonstrate these required skills and behavioural attributes. The focus of this slide is just to highlight that we ask you to give students feedback and opportunity for discussion at the end of week 1, or it might be that the timing works out for you to be that happens at the beginning of week 2. We recommend you use the marking guide as a guide to support you in this discussion. The discussion would include some feedback, but also for an opportunity for students to review their experiences across week 1, as it's possible you may not have spent the full week with each student. Students are asked to complete a reflective statement at the end of week 1 as well as week 2, which you can ask the student to share with you. However, it's not an expectation for you to see this reflection. But the reflection may help guide your discussion with the student and allow students to talk about the patients, the health conditions, the experiences they've had in week 1. And during this meeting, you might provide a summary of their progress to date. And the way we would recommend you do this is to discuss a couple of the indicators, perhaps ones that students are already demonstrating they're meeting, and just the examples of how they are meeting this indicator. But this meeting can also be an opportunity to consider any plans that might help guide the tasks the student can assist you with into week 2, or potentially be a signpost for students to request other learning opportunities. And I'll discuss that a bit more in the next slide. At the end of week 1, too, we do ask students to reflect on each indicator and the examples that are given within the marking guide, but they are not required to self-assess themselves as a pass-fail at that point in time. Also, we're not expecting you to say, yes, you're a pass or fail at this point in time. However, if a student is not meeting any of the indicators, as I talked about in the previous slide, it is really important you have contacted your clinical centre leader to discuss this, and either you or you together with your centre leader provide the student with the examples of the specific issues and discuss any strategies or way the student could improve to potentially enable them to pass the indicator. And again, I've just got some examples of that in a couple of slides. At the end of week 2, again, we ask you to meet with each student again, and this might be a similar type of discussion, but this time, at the end of week 2, it does need to be an outcome of your marking of the indicators, so completing the marking sheet, and ultimately the pass or fail on every indicator, which then indicates whether the student has passed or failed the learning outcome. Students are expected to have self-assessed themselves as a pass-fail prior to you meeting at the end of week 2. So again, this can be something you can ask the students to show you and can help support your discussion. This slide demonstrates what the marking sheet will look like. So just to give you an overview of some of the information we will ask you to input into that sheet. On this slide, we've given you an example of how you might use the marking sheet or the the examples of how students could meet those indicators. But this is just something you could utilise at the midway point. So towards the end of week 1 or beginning of week 2, just to support you in how you might give the students some feedback on how they're tracking. You don't have to do this in a written form. I've just used this written form as for the demonstration of this presentation. It could be something that you do verbally, but equally you are welcome to use the marking sheet at the midway form to also write this information down for students if you wish to. So the 2 indicators that I've just picked up in this example is around commitment to learning and communicating effectively. So in the commitment to learning discussion, we've just said that the student, so this is supposedly you providing feedback to the student, that the student has consistently demonstrated willingness to participate in the learning opportunities arranged for them in week 1, and the student has had a discussion about their learning from the session, and for here I've just picked that it was a speech language therapist. So we then ask you, as I said in the earlier slides, to also establish some plans. So how this might then create some learning opportunities for the students for the following week. And whilst I've already written this plan here, which makes it look like you've set the plan for the student, it's phrased as a question. And the reason we ask you to phrase some of the plans as a question is for the students to actually actively engage in their learning. So the plan is that you probably want them to spend some time with other members of the MDT, but you're asking the student, are there any other members that they'd like to spend some time with? And that enables the students to engage and also consider what it is that they would like to learn or see, or if there's perhaps something that they don't know about. In this instance, it happens to be an example of the MDT. Then within the example of communicating effectively, the feedback has been that the student has demonstrated appropriate language with patient K when the student was responding to the patient's questions around their health condition, and the student also checked that patient K understood their explanation. So you thought that was really good and was a great way that the student could demonstrate effective communication. So again, there's a plan, but it's phrased as a question. Are there any other aspects of communication that you'd like to focus on next week? So it might be communication within a team meeting. It might be communication to a patient's whānau. It might be communicating through undertaking a subjective assessment. You might need to provide some examples like that to students if they're unsure of what the learning opportunities might be. But as I said, also engages the students within their learning. So as said, this is just some examples of ways that you could communicate or provide feedback around that midway point, i.e. end of week 1 or start of week 2. And on the next slide, I'll just go through some examples where perhaps there's a mixed outcome in terms of the students' achievements at that midway point. This slide shows an example of what we might call some mixed feedback. Again, this is written at the point of time where it might be the midway feedback. And again, you don't have to write this down, but it's just again examples of the feedback you could be providing to students. So I've again used the same passing example for commitment to learning, but this time I've added in just a different example for demonstrating clarity in documentation. So this is an example where a student may have demonstrated an understanding of the SOAP or tap format. They were able to complete some accurate draft notes. They've responded well to feedback and made those improvements. And so again, there's been a discussion around a plan. So again, with these plans, similarly to the previous slide, I've written the commitment to learning one as a question. In this example here for the documentation, I've written the plan as what you ideally would like the student to be able to do. So that's if their draft notes continue to be accurate, they can input them into the patient's official health record. But again, we do encourage you to try and phrase this as a question to engage the student with that learning. On the fail column, the example we've given here is around professional behaviour. So again, this is just an example of something that might be a failing aspect. And in this example, the students arrived late twice during week 1. So the comments that you've provided to the student are that you discussed their late arrival after the first time the student was late, and what the impact of that of them running late is. So it's important that they contact you before 7:30, because the impact is that you end up running late because you're waiting for them in the office, and you end up being late for, again, I've just used an example here, you end up running late for a ward meeting. So the student, the second time they were late, did phone in to say that they were running late. However, they phoned you at 7:35, which meant you were still waiting. So there's still the same impact. Again, we ask you to set a plan. I haven't really put in a particular example of a plan here, but it might be that the student needs to demonstrate that they are phoning you if they're running late, but also explore perhaps the reasons why they're running late. Can they not find a car park, or are they on public transport? Are there some other ways that they can try to get to work earlier to ensure that they are running to time, to reduce that impact of you waiting for them and therefore running late to other meetings? We also encourage you that if a student is not meeting a learning or an indicator, which means they might not be meeting the learning outcome around that midway point, that you are also explicit to them that if that behaviour continues, or that lateness in this instance continues, the student is at risk of not passing this indicator. Really important to be clear about that. So you've demonstrated that you've given the student feedback, and if they continue to demonstrate that behaviour, that it's just despite the feedback, they have not been able to meet that perhaps by the end of the placement. So again, remember, if a student was to fail at the end of the placement, it's despite any feedback that you have given them. And this example of the marking sheet is really an example of some end of placement feedback. So where you have had to grade the student on that pass-fail criteria across all the indicators. So this example here would demonstrate a student who has passed all the indicators, which means they therefore have passed the learning outcome. And there's also some written feedback, which is examples of how the student demonstrated that they met that indicator. And as a reminder, once you have completed the final assessment form or the final marking form, please email the completed form to your clinical centre leader and to the student. As a final reminder, the assessment is one learning outcome with 6 skill, behaviour and attribute indicators. Each of these 6 indicators must be passed in order for the student to pass the learning outcome. So as a wrap up, I just want to say thank you again for your participation in taking AUT students on this clinical assistantship. We really hope you enjoy your experiences and we look forward to reading your feedback on the students' performance. Ka kite, thank you.